Welcome, dear colleagues, to one more episode of the podcast series Talking Policy. My name is Laura Amadori and I work for the Policy Hub. This podcast series is brought to you by the Policy Hub to share insights and content from the Migration Policy Repository in an interactive and analytical way, zooming into different migration policy work and reflecting on global trends in migration policy. Through the podcast series, you will have the opportunity to hear the experience of different colleagues around the globe, voicing inspiring stories of policy-related initiatives. The first episode of the podcast series is dedicated to the future of migration policy in the context of COVID-19 pandemic. This episode will allow us to reflect and share experiences from different contexts on how public policy are responding to the pandemic and how they are shaping solutions to the challenges and vulnerabilities brought by the current COVID-19 context. We are very pleased to be joined today by Lorenza Rossi, Regional Data App Coordinator, and Raffaele Bertini, Data Analyst from the MENA region. They will share with us a research that they conducted on the impact of COVID-19 on socio-economic outcomes of migrants and displaced population in MENA region. Let us now dive deeper into the study, starting with the first question. So, hi Lorenza, we are very pleased to have you with us. Could you tell us about the rationale for conducting this research?
Hi everyone, thanks for having us. So we started working on this project after making two observations. First, we noticed that COVID-19 was not only affecting the health of people that were infected, but also the lives and livelihoods of entire populations. This led us to focus on the socio-economic impact of COVID. Second, we gathered growing evidence showing that migrants and displaced population in the MENA region were affected by the pandemic in ways that were very specific. Despite this, we did not come across any study which analyzed systematically how and to which extent COVID-19 was affecting the socioeconomic outcomes of migrants and displaced persons in the region. With this aim in mind, we started to construct the research methodology. We adapted the framework of the United Nations Development Programme, the UN framework for the Socio-Economic Response of COVID-19, which acknowledges the importance of conducting socioeconomic assessments but does not specifically address the case of mobile populations. Relying on this framework, our study is structured around 6 key pillars: health, access to basic services and social protection, employment, macroeconomic frameworks, social cohesion, and mobility.
Thanks, Lorenzo, for explaining the context of the research. Now, turning to Raffaele, could you tell us about some of the findings related to these pillars and the types of action you recommended? I understand that there was a significant focus on health. Maybe we can start with this.
Yes, of course. Regarding health, a central finding is that the pandemic has made access to health more difficult for migrants and displaced persons. There are at least 2 main reasons for this. The first is that, as a result of the pandemic, migrants and displaced persons in the region have less financial resources, which impedes them from paying their medical fees. Another reason is that, as a result of the overwhelmed health services, migrants who require medical assistance sometimes face discrimination from health professionals, who gave priority to nationals of their country. That's why we recommend that all actors involved in providing access to migrants throughout the region continue to advocate for better and cheaper, or even free, access to national health services irrespective of migration status. In particular, and as already outlined in the IOM Global Campaign, we see advocacy related to the inclusion of migrants in national vaccination plans as essential to ensure the safety of all individuals.
Thanks a lot, Raffaele. Do you have any other findings under the health pillar?
Yes, we also look at how much migrants and IDPs know about the virus and whether they know what measures they can take in order to avoid the spread of the virus itself. What came out clearly is that different groups of mobile populations have more or less knowledge of the virus. For instance, it was reported in Jordan and Iraq that migrants who did not speak the national language were less likely to know how to identify key symptoms or where to get tested for COVID-19. On the other hand, migrants who had already been in contact with other communicable diseases such as Ebola were more likely to be aware of how the virus spreads. Lack of migrant information campaigns in some countries was clearly an issue, especially in the first phase of the pandemic. In this regard, it is important that humanitarian organizations continue to amplify and target efforts to raise awareness about prevention and control measures in migrants and displaced communities, ensuring that all populations have access to relevant information in a language they understand. For listeners working in this area, a United Nations guideline was developed to ensure the inclusion of marginalized and vulnerable people in risk communication and community engagement activities. We will post the link to this document.
Thanks, Raffaele, for pointing this out. Now, turning again to Lorenza, you mentioned at the beginning of the interview that an important feature of your study was its focus on non-health related issues. Could you expand a bit more on this? Maybe you could tell us about some non-health related results.
Yes, in fact, we've gathered significant data on various non-health related impact of pandemic, including data related to access to employment and income generating activities. For instance, what came out clearly from the study was that migrants in irregular situations were particularly at risk of reduced economic activities following the imposition of measures to contain the spread of the disease. Our study found that following the start of the pandemic, some employers in sectors that employ a lot of migrants in irregular situations, like constructions or factories, reduced their salary to mitigate the impact of the economic crisis. As such, it is essential that in the immediate term, humanitarian organizations continue to provide cash or in-kind assistance to all mobile population who lost their income-generating activities as the result of the pandemic. In the longer run, we also strongly recommend that IOM and other organizations continue to advocate for migrants' inclusion in national protection frameworks.
Thanks, Lorenza. Now I would like to ask Raffaele, considering the reduced opportunity for employment and increased competition for resources, have you noticed increased tension between migrants and host community as a result of the pandemic?
We have looked at the impact of COVID-19 on social cohesion, and the results are more complex. As you mentioned, the pandemic led to more competition over key resources, including income-generating activities and certain basic goods, which ended up creating tensions between different communities. In particular, we have documented a number of cases of physical assaults against sub-Saharan African and South Asian migrants due to the perception that they were disease carriers. However, COVID-19 has also led to increased occurrences of hospitality and solidarity. In Tunisia, the landlords, for instance, of several migrants refrained from evicting them despite not having received rent for several months as an act of support. In Jordan and Algeria, youth organizations distributed food and basic items to migrants early after the first lockdowns. For us, as IOM, we need to strengthen our wall of community approach, focusing on mobile population and hosts to support community cohesion and avoid instances of discrimination or xenophobia.
Many thanks for this. One thing that appears in your responses is that the results are not always uniform across migrants' profiles and geographical location. So maybe Lorenza can explain to us if data disaggregation is something you paid particular attention to.
Yes, absolutely. As we mentioned before, we've seen significant variation based on gender, socioeconomic profile, migration, legal status, nationality of origin, and destination countries. For instance, we noticed that migrants in irregular situations were particularly likely to experience negative health impacts of the virus, as they oftentimes refrain from going to health facilities for fear of apprehension by the national police. Overall, this demonstrates that it is essential to disaggregate data to determine the migrant profiles that are vulnerable to specific impact of the pandemic. In particular, due to the peculiarity of our region's migration profile, we have included into our analysis both working migrants and internally displaced people, and we try to emphasize that development nexus in countries in post-conflict or conflict countries.
Thanks a lot for this interesting point. How do these conclusions relate to the other global policy frameworks?
The work is highly relevant to several lines of IOM lines of work. In particular, it informs many objectives of the Global Compact on Migration, such as the first objective, which is to collect and utilize accurate and disaggregated data as a basis for evidence-based policy. Beyond this, we hope that our findings will feed into policy response for several other GCM objectives, such as Objective 6 on decent work, Objective 15 on access to basic services, Objective 20 on remittances, or Objective 22 on social protection.
Thanks a lot. Now we are heading to the conclusions, and I would like to ask to Raffaele, what are the next steps for this line of work?
We still have a lot of work to do for this exercise. The next step for us is to publish a report and a policy brief summarizing the main findings of this research. Then, we are also coordinating the publication of a special issue with IOM's migration policy practice on the socio-economic impact of COVID-19 in Africa and Middle East. Finally, we are supporting several country offices in the MENA region to conduct similar assessments using a standard methodology that we developed.
Many thanks, Lorenza and Raffaele, for your time and for explaining to us the research you conducted. We will be looking forward to the next phases of this research. If you want to access the full report on assessing the socio-economic impact of COVID-19 on migrants and displaced population in the Middle East and North African region, please access the Migration Policy Repository. Thanks to all.